How is an osteosarcoma biopsy performed? An osteosarcoma biopsy is a vital procedure that helps doctors confirm the presence of cancer in the bone. This process involves removing a small sample of bone tissue suspected of containing cancer cells. The sample is then examined in a laboratory to guide treatment decisions. The method used for the biopsy can vary based on the tumor's location, size, and characteristics. Before the biopsy, imaging tests like X-ray, computed tomography scan, or magnetic resonance imaging are performed. These tests help locate the tumor precisely and plan the safest way to obtain the tissue sample. This planning is crucial to avoid damaging healthy tissue and to ensure that the biopsy tract can be removed later if cancer is confirmed. The biopsy tract is often aligned with the planned surgical incision to prevent spreading cancer cells to healthy areas. When it comes to anesthesia, patients typically receive local anesthesia to numb the area around the biopsy site. In some cases, general anesthesia may be used, especially for children or patients who may not cooperate during the procedure. Regional nerve blocks or conscious sedation may also be applied to manage pain and anxiety. For a needle biopsy, a small incision is made over the tumor site. A special biopsy needle, often a drill needle designed for bone lesions, is inserted through the skin and into the bone under imaging guidance. The needle is twisted or drilled into the bone to retrieve a core or multiple cores of tissue. The number of samples taken depends on the characteristics of the lesion. Larger tumors may require samples from different areas to ensure accurate diagnosis. If a needle biopsy is not sufficient or feasible, a surgical biopsy, also known as an open biopsy, may be performed. This involves making a larger incision to directly access and remove a tissue sample or part of the tumor. This method allows for a larger sample, but it requires careful planning to avoid compromising future tumor removal. After the biopsy, pressure is applied to stop any bleeding, and the incision is closed with stitches and covered with a bandage. Patients receive instructions on how to care for the wound and any activity restrictions to promote healing and reduce complications. The biopsy samples are then sent to a pathology lab. Specialists examine the tissue under a microscope to identify cancer cells, determine the tumor type, and assess its aggressiveness. This information is essential for confirming osteosarcoma and planning the appropriate treatment. Performing the biopsy correctly is crucial. Improper technique can lead to tumor spread or result in a non-diagnostic sample. Therefore, osteosarcoma biopsies should be conducted by experienced medical teams familiar with bone cancers to optimize outcomes and ensure accurate diagnosis. In summary, an osteosarcoma biopsy is a carefully planned procedure that uses imaging guidance to obtain bone tissue samples through needle or surgery under anesthesia. The samples are then analyzed to confirm the presence and type of bone cancer. This procedure is a critical step in diagnosing osteosarcoma and developing an effective treatment plan.